Hey, what you doing? Are you doom scrolling other people's vacations? Miami, San Diego? With Expedia, your trip can earn rewards which you can use towards your next eligible stay. Soon, people will doom scroll you. Expedia, the one place you go to go places. Terms apply.
A hospital floor rarely ever feels still. There's always a call light going off, a family waiting for an answer, or a patient whose condition is starting to take a turn. Nurses are often the direct line to the patient, the ones tracking how someone's really doing and keeping everything on track. Lately, though, for nurse Katie Oberhelman, it's been harder to juggle it all. Oberhelman has been a nurse for more than a decade and works on the medical floor at St. Joseph Hospital in Texas. St. Joseph Health is part of Common Spirit Health, one of the larger Catholic nonprofit health systems in the U.S. Oberhelman says the biggest issue on her floor isn't one bad day or one hard shift. It's an environment created by Common Spirit that's always too stretched thin. One of the biggest issues is short staffing.
The unit I work on, we are a five patient to one nurse ratio. The less staff we have to support us, like our patient care assistants and that kind of support staff, it's hard. It's hard to provide care for patients that we call total care, that need assistance with everything: feeding, bathing, changing, all of those things. When you multiply that out by your 5 patients, if you have a very heavy patient load, it can be very taxing on you mentally and physically.
She says when other departments are short-staffed too, more of the work trickles down to the people already at the bedside because there's nowhere else for it to go.
Oftentimes, we're short-staffed across the hospital with dietary, respiratory therapy, lots of different facets. And so, delivering and picking up trays is often something that falls to us. Housekeeping things tend to fall to us, especially at night. There's not many housekeepers at night. And so, that could just be as simple as getting like blankets and things up to the floor, or just cleaning the rooms. Sometimes there's a big delay in that. So we do our best to assist them when we can. And I know, and not my unit, but in ER, they struggle with that, having to flip their own beds. So, when a patient gets discharged from the ER, they are having to do all of the cleaning to get that bed ready for another patient, which is time that could be spent in direct patient care and things that nursing shouldn't have to be doing. But if nursing doesn't do it, it just doesn't get done.
When nurses are pulled into everything else, there's less time for the work patients actually need them for: medications, check-ins, careful assessments, and the ability to catch problems early. Over time, this overflow can change how people feel about their job.
And so many of my coworkers, we go into nursing to help people. That was, our intention and what we want to do. And all of those extra tasks kind of pull us away from being as present as possible with our patients. And we've lost a lot of good nurses. They get very frustrated and move on to different hospitals that have better conditions, better pay.
When an experienced nurse leaves, a hospital doesn't just lose another person on the schedule, it loses the experience, guidance, and morale that came with them. These concerns at St. Joseph are also part of a larger worker safety conversation. This past spring, the National Council for Occupational Safety and Health published its Dirty Dozen list. The report highlights 12 companies where American workers have raised large concerns about unsafe and challenging conditions. One of the companies named is Common Spirit Health.
From workers, we hear things from unsafe staffing, workplace violence, exposure to chemical hazards. There's also when workers attempt to come together as a group to maybe unionize, there has been anti-union practices. So it's pretty alarming that even in healthcare, we're seeing that workers are not safe.
That's Jessica Martinez, the executive director of the National Council for Occupational Safety and Health. She says the report highlights just how many of these issues are preventable and fixable.
The Dirty Dozen exposes 12 companies where we know that profit is prioritized over human life. We know that these 12 employers are not outliers. They represent a system where safety violations have become the cost, essentially, of doing business. So there are some core themes that we have found in the report itself at the Dirty Dozen, and across industries, we are seeing, very similar patterns, that profits go up, but we are seeing protections for workers and human life go down.
The report is based on extensive research from OSHA and federal enforcement data, as well as court records, media reporting, and countless conversations with workers at these companies.
We know that OSHA has about 1,800 inspectors for 130 million workers across 8 million workplaces. So we know that these numbers are real because at that rate, it would take, really over 150 years to inspect every workplace just once. And that means that companies are often not afraid of the consequences. And when there are consequences, we know that the penalties are, a slap on the wrist, very, very low.
Back in Texas, Oberhelman shares that she and many of her colleagues have repeatedly brought these concerns to common spirit. However, it's become a chronic pattern of speaking with leadership and then radio silence.
I feel like in a lot of our staff meetings, they always say, we'll escalate it. We will take that to the higher management. And nothing ever changes.
To get action, they voted to unionize last December with the National Nurses Organizing Committee, a branch of National Nurses United. For Oberhelman, that decision wasn't about turning against the hospital. In some ways, it was the opposite. St. Joseph is where her career began, and she has a lot of fond memories of what it used to be like before Common Spirit took over.
We do serve a population of patients that other hospitals won't see for financial reasons, often, no insurance. We see a lot of those patients. That was one of the things that drew me to St. Joseph when I first became a nurse. I felt like I could do the most good at St. Joseph.
In addition to being overworked, she and others have raised issues about workplace violence, pest infestations, broken elevators, and other basic safety and maintenance problems. The difference now is that they have someone else in their corner fighting for them. For workers in any industry, Martinez echoes that there's always more power together. If you have concerns about your company, she says one of the first steps is to talk to coworkers and document what's happening before filing a complaint or asking for help from a union or local worker center.
Now more than ever, it's important that they start by talking to their coworkers to realize that they're not isolated and they may not be the only person dealing through a challenge at work or maybe a dangerous working condition. The power of collective action is really true and offers just more protections in a real sense, right? It's harder to retaliate against a group of workers than an individual.
Oberhelman is now on the bargaining team as St. Joseph nurses work toward their first contract. After years of feeling like decisions were being made somewhere else, it's a big weight off to finally have a voice. Still, though, the bigger question goes beyond St. Joseph's. Nurses are often described as the backbone of healthcare, but a backbone can only carry so much before the whole body begins to break down. When hospital systems run too lean, the strain affects patient outcomes, and the same issues are happening across the U.S. as more hospitals merge. For Oberhelman, the fight isn't just about nurses either. She says every role is affected by the policies set by leadership. That's why she hopes this first contract can eventually lead to greater change throughout.
While this is a nurses' union, every facet of our hospital is understaffed. And so our hope going forward is that in developing our union, we can help lay the foundation for meaningful changes for every part of our hospital. We work so closely with everyone and we see how frustrated they are, especially in this economy and everything.
A hospital can have the right mission statement, the right equipment, and the right employees, but if the serious issues that are brought up repeatedly never get fixed, the system starts asking the impossible from the ones who stay. You can learn more about this topic, the National Council for Occupational Safety, and our guests, Jessica Martinez and Katie Oberhelman, by heading to our website, viewpointsradio.org. This segment was written and produced by our executive producer, Amirah Zaveri. Our production manager is Jay Silvers. I'm Gary Price.
The In Good Health podcast gives listeners the latest news on what's trending in health, science, technology, and more, featuring medical experts who break down complex topics in a way that's easy to understand.
The mice that ate the salmon that had been fed the soybean meal diet got obese. So it's not just what you eat, but it's what the thing you eat has eaten that's important.
The In Good Health podcast, available wherever you find your favorite podcasts and at ingoodhealthpodcast.org.